Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. President Buhari extends the second phase of lockdown for another 4 weeks. Lagos State government formally enlists private laboratories into its testing strategy to avail citizens access to speedy and ready COVID-19 tests. And Ghana's healthcare workers get extension, 50% increase in basic salaries as country battles the coronavirus. Africa has recorded over 380,000 confirmed COVID-19 cases, with more than 181,000 recoveries and almost 10,000 deaths. The Economic Community of West African States, ECOWAS, COVID-19 dashboard shows the top cases in the West African region, with total active cases at over 32,000 and deaths put at over 1,200, with over 40,000 people who have recovered. Nigeria, Ghana and Côte d'Ivoire are the top 3 states with the highest figures in the region, accounting for 70% of the total confirmed cases, which stands at over 73,000 in the region. In Nigeria, the Center for Disease Control, NCDC, puts the total confirmed cases at 24,567. 9,007 people have been discharged and the death toll stands at 565. The country has conducted over 130,000 tests across 35 states and the FCT. Yesterday, the country recorded 490 new cases of COVID-19 spread across 20 states, including the FCT, with Lagos State, Delta State and Ebonyi recording the highest cases from the new infection. Total active cases in the country now stands at 14,995. A look at the breakdown of the highest cases in each of the 6 zones shows Lagos in the southwest with 10,144 cases, the FCT in the north central with 1,792, Kano top in the northwest with 1,200 cases. In the south-south, you have River State topping that region with 1,056 cases, Bauchi in the northeast with 500 cases, while we have in the southeast the top state there with 395 cases. Now, following the eve of the expiration of the second phase of lockdown eased from the federal government, members of the Presidential Task Force on COVID-19 earlier today visited the president to brief him on the fight against the virus in the country. It was gathered that while other members of the delegation were said to have left the presidential villa, the secretary to the government of the federation and chairman of the task force remained behind, later briefing correspondents. And at the Presidential Task Force briefing after that visit, the chairman, Mr. Boss Mustafa, said that although progress has been made in the establishment of 39 molecular laboratories, increased surveillance and monitoring across the country, there is need to take stiffer actions in flattening the curve. Today, he announced an extension of the second phase of the lockdown ease for another 4 weeks to begin on Tuesday, June the 30th.
Today, the Presidential Task Force submitted its 5th interim report to Mr. President for his consideration. In the report, the PTF specifically reviewed the issues around the general level of compliance with prescribed measures while taking note of the following. 1, implication of the lack of general compliance with measures. 2, the global and domestic developments, especially in the area of rising statistics. And 3, the continued restriction in the education and transportation sectors, as well as for activities that attract mass gatherings, such as operations of market, places of worship, and entertainment. I am pleased to inform you that Mr. President has carefully considered the 5th interim report of the PTF and has accordingly approved that, with the exception of some modifications to be expatiated upon later, the phase 2 of the eased lockdown be extended with another 4 weeks with effect from Tuesday, June 30th, 2020 through midnight of Monday, 27th July, 2020. Specifically, however, the following measures shall either remain in place or come into effect. 1, maintaining the current phase of the national response for another 4 weeks, in line with modifications to be expatiated upon by the national coordinator. 2, permission of movement across state borders only outside curfew hours with effect from 1st July 2020. 3, enforcement of laws around non-pharmaceutical intervention by states, in particular, the use of face masks in public places. 4, safe reopening of schools to allow students, only students in graduating classes, resume in person for preparation for examinations. 5, safe reopening of domestic aviation services as soon as practicable.
Chairman of the Presidential
In the meantime, the National Coordinator of the Presidential Task Force expatiated on a few modifications, which include some considerations for reopening of schools, especially for junior secondary schools, senior secondary, to write their final examinations. He also talked about the reopening of air services, which should be as soon as is practicable, among other measures.
I'll now briefly take you through some of the changes in greater detail. Some haven't changed that much. So the curfew, for instance, remains at 10 p.m. to 4 a.m. nationwide. People are allowed to go out for work and to buy necessary food and exercise, as well as continuing to move between local governments, especially in areas that are not high-burden local governments. For personalized services, mechanics, artisans, hair salons, etc., who own their workshops or workstations and can clearly adhere to non-pharmaceutical interventions will be permitted to operate as normal. For markets, there is no specific change to what we already have in phase 2, and this will be driven by local authority arrangements. For hotels, restaurants, and eateries, there is no specific change. Hotels must observe all mandatory non-pharmaceutical interventions. Restaurants to remain closed for eat-in with strict cleanliness guidelines, except for restaurants that are serving hotel residents. Bars, gyms, cinemas, event centers, and nightclubs remain closed, and this will be enforced. For educational activities, daycare and primary schools, all daycares and primary schools to remain closed till further evaluation. Schools are encouraged to continue with e-learning and visual teaching, but pupils may proceed to take the National Common Entrance as soon as is feasible, provided there is compliance with issued non-pharmaceutical interventions.
In Lagos State, the government has secured some private laboratories as it intensifies its coronavirus disease testing capacity. The Commissioner for Health, Professor Akin Abayomi, said at a briefing on the COVID-19 situation that the state had reached the capacity in terms of the active community transmission, and that the next strategy is to work with the private sector to carry out sophisticated COVID-19 testing.
As you well know, we've reached the level of active community transmission. The key strategy for the next policy of the government is twofold: to manage patients that are unwell in our isolation facilities, where we have higher level of care, including intensive care and oxygen therapy, and to manage those that are mild or asymptomatic at home. But isolation is still the central focus. So either you isolate in a facility or you isolate at home. So to expand our testing capacity, we've identified potential opportunities for us to work with private sector. and we've identified laboratories that can do the sophisticated level of testing that's required for COVID-19. This graph shows you that we have reached a stage where we've diagnosed over 10,000 cases.
Going to guess. Now, Dr. Abayowa Edukugo is a field coordinator, epidemiologist, Stop Polio Focal Point at Polio National Emergency Operations Center, the African Field Epidemiology Network, that's AFRINET. He joins us from Abuja studios. We'd like to thank you for joining us on the program.
Thank you for having me.
All right, let's begin with your thought on the extension of the second phase of the lockdown ease by the federal government. What results do you expect?
Okay, so having critically analyzed the issues from the current phase up to now, we are hoping that this in the next 4 weeks, we're going to have based on evaluation of what has happened, we expect that cases will not rise as much as that, because there are public health experts who have been going through and looking at figures based on the previous lockdown, and so we're expecting that as we go into the other phase, that cases will be managed and will not be able to rise like we're seeing now.
But one important modification in this phase, which will begin tomorrow, is that some form of travel, interstate travel, can also begin. But a number of people who have spoken are not quite comfortable. And if we look at previous comments by the task force, interstate travel is also one of the ways that we're seeing a spike in more COVID-19 cases across states in the country.
That's true, but it's important to also note that you can't also keep people away too long from moving, from having their daily activities, and that is why government has also, in doing this, have also emphasized the non-pharmaceutical interventions. We need to, in the public places, you need to wear your face masks, you need to have social distances, you need to have measures. I'm sure in the motor parks, measures have been put in place to have these non-pharmaceutical interventions established there. Washing of hands and having sanitizers and having space out in vehicles when they are traveling, because it's important to also, when you are taking decision, you take decision based on the economic situation of the people. People have stayed at home, and a lot of and government has considered that a lot of people are hungry. So in trying to ease all of this, looking at a lot of factors, economic factors, and so forth, we need to look at a situation where people will be able to move out and be able to do their things, meanwhile still being able to maintain the ability to be able to stop or to curtail transmission. So in this, as this second phase begins to go, we will need to enforce the non-pharmaceutical interventions. When you are traveling, you wear your face masks. At the motor parks, social distances are maintained. In carrying passengers, you need to maintain the social distance, even in the vehicle, because people have to move. So those are the things that will have to be enforced by the authorities at the parks, at the airport, so that people's life can gradually return back to normal.
Taking further responsibility. We'd like to thank you, Dr. Abayowa Edukugo, Field Coordinator, Epidemiologist, Stop Polio Focal Point at the Polio National Emergency Operations AFRINET. Thank you for joining us on the program.
Thank you for having me.
We have more on the COVID-19 update when we return. In Bauchi State, the government has launched a new laboratory with capacity to test up to 300 samples a day. The Governor, Bala Mohammed, gave a breakdown of the lab's capacity while also giving the COVID-19 case management update in the state.
It is pertinent to note that the NCDC has declared this laboratory as one of the best in the country, with the capacity to perform up to 300 tests per day. In addition, it can also perform the following tests: COVID-19, highly pathogenic avian influenza, HINY, cerebral spinal meningitis, cholera, shigellosis, measles, tuberculosis, HIV viral load, and many more. Ladies and gentlemen, this center is not only strategic for the state in the area of testing, it can equally help our neighboring states like Jigawa, Yobe, Gombe, Adama, and Taraba, as testified by UNICEF.
Now, states, ministries of health and their task force are leading the response at subnational levels. But how much is ongoing in terms of enlightenment, which is key to the COVID-19 fight? Borno State has the highest number of confirmed cases in the northeast, and the Commissioner for Information and a member of the state's COVID-19 response team joins us on efforts to curbing misinformation in the state. He joins us from our Maiduguri studio. Mr. Bakura Abajato, welcome to the program. I'd like to begin with your reaction to the extended phase of the second lockdown ease and how it affects you in Borno State.
Well, normally the cases that we have around in Maiduguri, most of the cases are imported cases. True to say, within Borno State, I think right from the index case that we have, most of the cases that we have been recording of recent are those people who are traveling into Maiduguri from other parts of the country. We have a quarantine center. In addition to the quarantine center also, from the inway into Maiduguri, at the checkpoint where people come into Maiduguri, there is a checkpoint at Njimtilo by the university, State University. People need to come down of their vehicles. They need to be checked for their temperature and all those things. And then from there on, they will be conveyed to the quarantine center, which is at the Hajj camp. And at that Hajj camp, that is where the actual sample will be taken. And it is from those samples that we normally collect that we find cases of COVID-19. But for the city itself, I think the city is very much more, safe in terms of that thing. So I think the easing and extension of the lockdown, and of course, coming up with this interstate movement, I think we need to also gear up to see that people who are coming into Maiduguri are actually really being checked and confirmed to be COVID-free before they'll be allowed into the city. Normally, what they do is at the quarantine center, they are housed. They stay there for at least 3-4 days until the results of the samples collected, confirmed that these people are actually positive or negative. The positive ones are taken directly to the isolation center, while those who are confirmed to be negative, they are allowed to go into the city and then unite with members of their family. Now also the state government has acquired new, digitized testing facilities, and those facilities are going to be used, so that within a good and a little time, the tests can be conducted and then the result will be obtained. Those digitized machines can also be done without these DNA and, of course, RNA extractors. So those things, I think, but the moment they are available, I think we are going to be in good shape. But as for now, the tests are conducted in 2 different places, at the University of Maiduguri Teaching Hospital, and then the other one is at the State Laboratory Center, where those samples are collected, transported to, analyzed, and then the result brought back to the quarantine center before allowing those people who came into Maiduguri from elsewhere will be allowed into the city.
Finally, I must ask you, Mr. Abajato, and that is, what is the level, if you were ranking on a scale of 1 to 10, what would you say is the level of awareness that COVID-19 exists and COVID-19 is not malaria that the people in Borno State have of coronavirus?
Well, it is the case in most part of Africa, Nigeria, and everywhere. People are so much, lackadaisical about it. People do not look at it as a very serious case. Hitherto, people are afraid and scared. But, as time goes by, there is this breaking of the element of fear. People now, tend to look at COVID-19 as any other disease. But the main thing is that the level of awareness and the campaign that we keep doing is so much, it is massive. We started before everyone else. There are jingles running on radio stations. There are jingles running on TV stations. We also have the mobile ban. And all forms of information, the management and dissemination assets are deployed, particularly the public address system that goes into nooks and crannies, wherein people, do not, maybe some people you may think they don't listen to radio. Even if they do listen to radio, they don't, listen to it with rapt attention. Places like marketplaces, all these places, including the National Orientation Agency. They're also doing a very good job. In addition to the supply of wash hand stations at various public places, supply of hand sanitizers, and of course, we sometimes go to the extent of distributing face masks at the designated areas, particularly those areas where we have a lot of people coming together to conduct businesses. Maybe marketplaces, the Sangaya institutions, and all these things. We do give them the face mask. But the main thing is that we still need to put in more efforts in terms of public awareness, the sense that people now tend not to even believe it.
We'd like to thank you, Commissioner for Information and member of the state's COVID-19 response team, Mr. Bakura Abajato, on Borno State's COVID-19 response. Thank you for joining us.
Thank you so much.
Now, Ghana's president has announced an incentive package brought for health workers when coronavirus hit the country to be extended for another 3 months. According to the government, they will continue to enjoy a 50% increase in their basic salaries and will not pay income tax for the months of July, August, and September. President Nana Akufo-Addo, in a televised address, said that incentives were intended to motivate health workers in the wake of the pandemic. There's also more on our global updates.
In Brazil, just over 30,000 new COVID-19 cases have been recorded, taking the Latin American country's total to 1.34 million. Of those infected, 730,000 have recovered from the virus. Following a devastating 522 deaths in 24 hours, the country's death toll stands at 57,622. As cases continue rising in 30 U.S. states, the Texas governor speaks of a swift and very dangerous turn. In California, cases have topped 215,000. Governor Gavin Newsom has ordered bars, breweries and pubs to be closed in 7 counties, including Los Angeles and in California. For the 3rd day in a row, Georgia has broken its record for new coronavirus cases in a single day, reporting 2,225 confirmed cases, topping 2,000 for the first time. Cases are surging in Leicester, resulting in pubs and restaurants in the city possibly staying closed for 2 more weeks. UK Prime Minister Boris Johnson says he's concerned about a rise in coronavirus cases in Leicester.
Coming out of the medical code.
In Bradford, Rochdale and Barnsley, there are also higher level of cases than the rest of the UK in recent weeks.
With the absence of a vaccine, non-pharmaceutical interventions such as the use of a face mask, physical distancing, hand hygiene remain the most effective strategy to limit COVID-19 spread. You can find the latest guide on the NCDC website on keeping safe and taking all necessary precautions to prevent it. The World Health Organization has the latest updates on the global response to the COVID-19 strategy. Their website guides a public health response at national and subnational levels. You can take a look at some of the numbers and information in real time. Our website, channelstv.com, has more updates. You can see the breaking news there and several other stories, more on the pandemic and other stories across the world. That's the COVID-19 update program. Thank you for watching. I'm Millicent Walker.